Challenge in Alberta and everywhere in Canada and North America around prescription drug abuse. So we've taken a number of steps around setting a standard for our members. We have to be very mindful if you're going to start a patient on opioids that you use the lowest possible dose, that you are as rational in prescribing, that you set goals with the patient, that you monitor the patient carefully, that you check their medication records. You follow them up very carefully because these are drugs that have risk. But if we look at the numbers, there are an awful lot of patients who are receiving very high doses of opioids. And so, you know, that's the group of physicians that we want to be more mindful and rational in their prescribing, not to put patients at risk, not to disadvantage patients who are on long-term opioids. Ideally, we won't create another generation of patients with an opioid misuse disorder.
Now, joining us tonight is Amy Graves, founder of the Get Prescriptions Drugs Off the Street Society. Welcome to Alberta Primetime. Nice to have you here, Amy.
Thank you.
I'd like to start with some disturbing statistics released from the province. When it comes to fentanyl-related numbers only, 343 people died from an apparent overdose last year. Of those, nearly 1/4 of people had filled a prescription for an opioid in the previous month, and almost half were prescribed opioids from 3 or more healthcare providers. Amy, you lost your 21-year-old brother in 2011 if he had an overdose of one type of opioid drug. So even before the recent announcement of the new regulations doctors need to face, you had concerns about how many had been actually checking the medical history of patients.
Exactly. Doing investigating on the triplicate program in Alberta, I discovered that over 1.8 million prescriptions were written, but doctors only checked the program just over 700 times.
So then what impact do you think these new rules will have? What's your thought hearing about all of it?
Well, hopefully doctors can make more educated decisions when prescribing and better know what the patient has tried in the past and what any trends they see. And hopefully, too, they will better educate a patient if the choice is to start opioids on the risks and what that entails.
I hear you say hopefully a lot. Do you think these rules are going far enough?
Well, I just have to wonder what the accountability factor is. Who's going to be monitoring the monitoring system?
I do know that Dr. Thiemann from the College of Physicians and Surgeons, who we just heard from, he has been saying that doctors can be written up for unprofessional conduct if they don't follow the rules.
I'm just wondering who is going to be the who's going to be overseeing this, and how often are they going to be collecting data? How is it going to be analyzed? And yeah.
Sort of like a wait and see mindset here with it.
Sure, I've kind of kept track of other monitoring programs across the country, and they sound great, but it's all what you do with the information and how accountable the program is to make it really successful.
Okay, there's also been some fears voiced that limiting access to legally obtained prescription drugs could turn people to the black market. What about that? Does that concern you?
Certainly. Doctors should not be just cutting off patients and wiping their hands clean. That'll just cause more harm. If they identify someone they feel could be addicted to opioids, they should be helping them find the resources for treatment, gently tapering. It will cause more harm if they're simply cutting patients off.
Okay. On Friday, Alberta received a $6 million boost in federal funding to deal with the opioid crisis. That's in addition to $75 million previously announced, all part of a 5-year plan to address the issue and provide supports.
Alberta, like British Columbia, has been disproportionately affected by overdose deaths, and so we agreed to support Alberta in those emergency needs in the order of $6 million.
Now, according to Alberta's Health Minister, Sarah Hoffman, the funding will complement money the province will announce in this week's budget, and it will support many resources, one being supervised consumption sites. Amy, how important is all of this?
Extremely important. We need to make sure that the funds get to the people who need it the most now. We need to save the lives of the people using with safe consumption sites, opioid substitution therapies. People need accessible treatment, especially if prescribing practices are going to be adjusted.
There are some groups that also say it's so important to have so many different key players involved, more of the overall discussion in the province.
Sure, you need collaboration because this issue affects many stakeholders: enforcement, healthcare, even education. I think we need better opioid education for doctors and the public, not just on fentanyl or just the recreational aspect, but a broad educational campaign so people can learn the risks of both prescribed and illicit opioids.
Amy, take us back after it happened there in 2011 and society's mindset at the time and how it has evolved over these few years.
Well, when my brother passed away, there wasn't as much awareness, I guess, around the harm that opioids were causing, mostly in part, I feel, because at the time, most of the opioids that were being abused or used were from doctors' prescription pads. And then the lack of action created a whole group of opioid-dependent people, which now organized crimes decided to capitalize off of with illicit fentanyl.
And so then the group was formed, Get Prescription Drugs Off the Street Society. You were involved in that?
Yes, we started that initiative. It was 9 days after my brother's death. Just advocating for action on the opioid epidemic, whether it's treatment, more responsible prescribing. There's so many facets. So really, and to create awareness. Many people did not realize how many people were dying from opioids.
And then now, how is it going in your quest to educate people?
It's disheartening after 6 years of doing this and seeing the evolution of fentanyl come in and take even more lives. I wish that more would have been done prior, and I think a lot of lives would be saved, and maybe organized crime wouldn't have had such a large market to capitalize off of.
Definitely. There's so many different orders of government, provincial, federal, even municipal, that consider this very serious, the crisis. And so going forward, what would you like to see further?
Well, we need to destigmatize the issue. I think that has improved over the last 6 years. You see more and more people coming out and talking about this. That's helpful. The more voices we can have to the issue, the more pressure it puts on government. And we just need that acknowledgement that opioids are not necessarily safe as prescribed. I've heard so many stories of Albertans starting opioids for legitimate pain and then ended up transitioning down the road to fentanyl, and that being a tragic ending.
And so now with the new rules for doctors and prescriptions and the new money for funding, I know you're going to be keeping quite a close eye on the situation here in Alberta.
Certainly.
Amy?